In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
Hi, welcome to my practice. Great that you're here. I've just been reading the fan mail, and there's a mail from Gudrun Schiemann from Australia, and she's been smoking for 60 years and she really wants to quit, and she says that she tried numerous times, but so far she hasn't been able to overcome her addiction. Now, she wrote us, without the help of In Good Shape, she'll never be able to quit. What a stroke of luck that I know the perfect expert for this. This is Dr. Thomas Hering. He's a pulmonologist and an expert in smoking cessation. Why is it so hard to quit smoking?
Well, most of the smokers are addicted to smoking, and this addiction works in two ways. It has two elements that draw the smoker to take cigarettes and smoke again. One element is the nicotine addiction. The other mechanism of smoking dependence is the fact that they get used to combine certain situations in life with smoking, and thus the association of those situations is compellingly bound to having a cigarette. So those two mechanisms in combination result in the addiction.
When I speak to my patients and I advise them to quit smoking, many of them tell me, well, I smoked for years now, I'm quite old, I think there's no use in quitting smoking at my age. So what do you say to them?
In fact, in most cases, there's a huge benefit for any patient to quit smoking. That depends very much on his specific situation, what diseases he has. And we as physicians may advise specifically for a cardiac patient, we will advise differently from a pulmonologist patient, for example. The risk to have a cardiac, a myocardial infarction decreases within hours and days after quitting smoking and is halved after 1 year, and is diminished to almost the risk of a never smoker after 3 years. This is the best benefit a smoker can achieve with quitting smoking.
So it's really worth to go for it.
Yeah.
We got this letter with a cry for help from our Australian viewer, Gudrun Schiemann. And she desperately wants to stop smoking, but she's not performing for this. So if she would come into your practice, what would you offer her?
The main smoking cessation measure is behavioral therapy, which takes some time, and we have kind of a 3-element program where in 3 sessions in groups we offer first the preparation, and then in a second session the stop smoking session where all the participants really smoke their last cigarette, and then a stabilization session. And we support this behavioral therapy intervention with medical support. There are a kind of medication, 3 substances that we can give to support and to stabilize the effect of the behavioral therapy.
And what are your results? How many people do really stop smoking for years after that?
After such an intervention, we see about between 35 and 50% that are continuous ex-smokers after 12 months.
So what's your take on e-cigarettes?
The government of UK has published an estimation that the risk from e-cigarettes is about 5% the risk of a tobacco cigarette. So anyway, it may be a risk. So the best is the zero consumption.
Right.
But we have cases, mainly the pulmonologists' patients with COPD, where we desperately need to help the patient quitting smoking. So no, not the least, smoke should enter the bronchial system. And in those cases, the e-cigarette may be a tolerable alternative, as in the e-cigarette, the patient inhales vapor and no smoke.
One important thing in smoking cessation, you said earlier in the previous talk, is behavioral therapy. So if one of our viewers right now wants to stop smoking altogether and they don't want to go to a behavioral therapist, can they do some, say, tweaks in their life that they can put some kind of behavioral therapy in their own lives?
For sure. It's a matter of good preparation, actually. They may analyze their smoking situations by having kind of a diary before quitting, a diary in which situations they usually smoke, and how much was the urge to smoke. And they may take down notes and analyze the most dangerous trigger situations and might change those situations. For example, if they have breakfast with coffee in the kitchen in the morning and they understand that this is a strong trigger situation for them, they might change and have their breakfast in another place of their flat and maybe change to tea, and thus decreasing the trigger, and so may be successful and avoid it.
What do you think about smoking cessation with the help of patches, nicotine patches?
Yeah,
or
this
gums?
is an important support. It is a support. The main thing is the change of behavior. But using nicotine patches, for example, or gums, or there's a spray in the market now, which this is a very important support to decrease the withdrawal symptoms.
Our viewer Tommy Allen from the US wrote us, he quit smoking 2 years ago, but since then he's been addicted to nicotine gum. So what can he do?
Well, actually, he should be proud that he quit smoking. Right. This is the main goal, and obviously he reached that. The nicotine by itself is not a real dangerous substance. So actually, I think he should try to get rid of the nicotine gum after time, but it's not a real concern.
So he'll be fine. Yeah. So Walter Kormanicki smoked for over 20 years, and he had 3 needles pierced through his earlobes in China, acupuncture treatment, and he never puffed again. So how successful is this complementary medicine like acupuncture treatment in smoking cessation?
Well, it's very good for Walter, then he succeeded. The general database on acupuncture as a smoking cessation measure is disappointing. So actually we wouldn't recommend it in a general way. The effects may depend very much on the attitude of the patient to the method he gets. And if the attitude and the expectation is very strong, he should try. And if he's successful, then very well.
Okay. Thanks so much for having me today.